back to our Wednesday Wellness webinar. So today we will be discussing about tuberculosis, and tuberculosis is a very wide topic, but we will be focusing on pulmonary tuberculosis. What are the key topics? So definition, types of tuberculosis, signs and symptoms, risk factors, diagnosis, treatment, and prevention. So what is pulmonary tuberculosis? It is a potentially serious infectious disease that mainly affects the lungs. The bacteria that causes tuberculosis are spread from person to person through tiny drops released into the air via coughs and sneezes. So it is airborne. And then the type of bacteria that causes pulmonary tuberculosis is Mycobacterium tuberculosis. And tuberculosis also is not just found in the lungs, but they can also affect the other body parts such as kidneys, spine, and brain. But the symptoms may vary kung ano-ano yung mga parts na affected ng tuberculosis. So these are the chest x-ray. So yung normal, wala kayong makikitang any spots or any circles dyan. But when you look at chest x-ray with tuberculosis, so merong mga bilog-bilog, sometimes merong mga foggy pictures dyan or image sa chest x-ray nila. So what are the types of tuberculosis? So we have latent TB and the TB disease or the active TB. So the latent TB, the virus itself, does not grow inside the body. If malakas yung immune system natin, there's a tendency na hindi magiging active yung TB. So you will not get sick, you will not experience any signs and symptoms, and then it will not spread to person kasi nga your body was able to compress or to control the bacteria inside your lungs. And then if nag-weaken yung immune system mo, there's a tendency that it will be progressed to active TB. So yung active TB natin, it grows inside your body. And then you will experience the signs and symptoms, and then it will really spread from person to person. And if it is not treated properly, it may lead to death. So what are the signs and symptoms? So cough that lasts more than 3 weeks, coughing up blood. So ang blood dito is fresh blood. And then chest pain. Kapag matagal naman kasi yung blood na nasa katawan natin, sometimes hindi na siya fresh blood. Parang blackish na siya na color ng blood na dinudura natin. And then high temperature and night sweats. Of course, on the first stage ng infection, mataas yung body temperature. But along the way, pag medyo nagpa-progress na yung signs and symptoms natin, meron ka ng low-grade fever and then night sweats. And then you will feel tiredness and fatigue, and then loss of appetite, swelling in the neck, and then weight loss. Yung swelling in the neck, nag-a-appear yan, it's because of your lymph nodes na nilalabanan ng immune system mo yung infection na meron sa katawan. And then what are the risk factors? So as what I mentioned, pag weakened yung immune system mo, you are high risk. So common yung HIV or AIDS patients kasi nga mababa yung immune system nila and their immune system are not functioning well. And then if meron kang previous respiratory infections such as pneumonia, mga bronchitis, mga ganun na mga medical condition, pag napabayaan and it will not be treated properly, then it will be progressed to PTB. And then severe kidney diseases, diabetes, and then cancer treatments such as chemotherapy. So if a specific person underwent chemotherapy, magiging weakened yung immune system nun. And then with prolonged contact with infected person, so kapag na-expose ka sa infected person, and then meron kayong, you are not practicing proper hygiene, then there's a tendency na mahahawa ka din. And then using tobacco or cigarettes. So of course, alam natin, cigarettes will contribute a lot. It's because may mga bronchioles natin, it destroys the natural mucus of our lungs. So there's a tendency na hindi din mafa-fight ng lungs natin yung bacteria na meron tayo or na-acquire natin. And then live or work in areas where TB is common such as prisons or nursing homes. So if you were able to remember yung sa may natin sa mga prasuhan, so yung mga sakit doon, very rampant yung PTB. It's because dikit-dikit yung mga tao, there's no proper ventilation, so yung bacteria umiikot lang sa mga prisoners. In the nursing homes, it's because nga may mga matatanda, mga geriatric patients, they are weakened immune system. So mabilis lang talaga sila makapitan ng PTB. And then work in healthcare and treat people with a high risk of PTB. Of course, like hospital. So sa hospital naman yung mga nurses, meron namang isolation area but hindi siya naiiwasan talaga na puntahan since you have to get the vital signs. So the nurses needs to take medications also as a prophylaxis para hindi din sila mahawaan ng PTB. And then children who are exposed to adults at risk of TB, it's because mababa din yung immune system ng mga bata and yung immune system nila, they are still on the progress of developing it. Kaya high risk din sila for getting pulmonary tuberculosis. So what are the diagnoses that they are using? So doctor will recommend this test para ma-confirm if a patient has a pulmonary tuberculosis. So physical exam, of course, makikita dyan. And then skin test, blood test. So skin test and blood test, ginagamit yan for latent TB. And then the acid-fast bacillus, yung sputum ni patient, lalagyan siya ng acid-fast bacillus or bacteria. And then they will check if nagre-react doon, then there's a possibility na positive na pulmonary tuberculosis nga meron si patient. And then imaging test, checks X-ray, yung nakita nyo kanina. And then sputum test. So yung sputum, kailangan kinokollect talaga siya yung galing talaga mismo sa lungs. So hindi lang siya yung laway mismo. So yung sputum talaga or yung phlegma itself, i-culture yan and then it will be studied by the laboratory personnel, and then from there they will be able to identify if yung bacteria na nandun sa sputum mo is PTB. So what are the treatments? So before you will undergo the treatment, if you were diagnosed with PTB or positive ka sa mga signs and symptoms and diagnosis, of course, your doctor will recommend medications like this. However, you can also coordinate directly to your barangay health center or your third barangay, and you have to let them show your chest x-ray or lahat ng medical documents na meron ka, and then they will refer you to TB dots. So yung TB dots, sila yung responsible for giving medications. So of course, while taking this treatment, there would be a monthly monitoring kasi yung iba dyan, yung side effect niya is walang ganang kumain, sometimes may gana namang kumain, pero hindi siya consistent yung effect sa kanila. So sometimes yung urine mo nagko-color yellow, so there would be a specific discussion of the side effects of the treatments once tinake yun ni patient. And of course, pag ang treatment for PTB, maximum treatment niya is 6 months. So ano yun, dapat every day, and then you have to take your medication in a proper time, and kailangan full stomach kasi nga medyo tapang yung gamot kasi nga they are killing the bacteria itself kasi hindi lang siya namamatay sa mga simpleng antibiotic. So you need to take higher dosage of antibiotic para well-treated ka. And if you will feel also na parang okay ka na, hindi ka na inuubo, nakakatulog ka na mahimbing, you need to take the medication kasi there's a tendency na pwede siya mag-recur or mag-reactivate. So, ulit ka na naman ng medication mo. So, magsa-start ka na naman from zero. So once you started the treatment, then you have to complete the treatment para you will be totally recovered and hindi magre-reactivate. And of course, modification of lifestyle will really help para at least hindi na babalik yung PTB. So what are the preventions for latent TB infection? So your doctor might advise you to take medications to reduce your risk of developing active tuberculosis. So once magkaroon kayo ng any respiratory infection, you have to follow your medications and take it kasi nga kapag napabayaan, it may progress to active TB. So for active TB, you have to stay home. Of course, isolation is one of the management, and then ventilate the room. So you have to open your windows and then cover your mouth. So it means to say you have to wear mask. Ayan. And then when you sneeze or cough, you have to make it sure na yung ginamit mo na tissue or any materials na inisnis mo na ginamit, you have to throw it away and wag mong ihalo sa mga kitchen trash kasi nga ano yun sa'yo, contaminated. And then you have also to separate your utensils. So for proper hygiene, you have also to wash your hands and finish your medication. And of course, ang PTB, meron tayong vaccination. Before they give the vaccination, you have to consult your doctor first para they will be able to monitor you kung ano yung mga adverse reactions, ano yung mga what to expect and not to expect kasi nga this is PTB, so airborne siya. It will really affect or transmit via air. So that's all for today. So for our next week's topic, that would be pleural effusion. It is something to do with our lungs. So pag ang PTB nag-progress siya, so the next level niya is pleural effusion. So if you have any questions or clarifications or topics that you want us to discuss, then you can reach out to clinic team or APOSI clinic team Skype account so that we will be able to share it to you. So thank you for your time, guys, and have a great day. Bye.